Any treatment that is prescribed will only work if taken. Based on the history of this patient, it appears that his bleeding is related to lack of adherence rather than too low of a dose or traumatic injuries. An extended half-life factor 9 clotting factor may be a good option for him since it would allow for less frequent infusions. The data presented by Shapiro and colleagues at the 2018 ASH meeting identified reduction in treatment burden as the most common reason for switching to an extended half-life clotting factor and demonstrated excellent adherence. However, even with a more convenient product, the patient still needs educational support and strategies to remember his infusions. The HTC can provide education about the impact of recurrent bleeding on joint health and the benefits of prophylaxis. Having him identify treatment goals and helping him look at how bleeds may interfere with his short and long-term goals could motivate better adherence. Finally, peer-to-peer approach might help motivate him to stick with the treatment plan. If the patient decides to switch to an extended half-life factor 9 clotting factor, then he has 3 options to choose from, including Fc fusion, albumin fusion, and pegylated products. Pharmacokinetic studies can be conducted to determine individual half-life and dosing frequency. Upon switching, there should be monitoring for inhibitor formation and any adverse event. However, in the Beyond trial of recombinant factor 9 Fc, no patients developed inhibitors during the follow-up period, and there weren't any unexpected adverse events.